Good evening, everyone. Jai Gurudev. We'd like to welcome all the doctors here for today's session. Happy mom, happy child. It's a wonderful uh, event with all of you. And I'd like to welcome all the doctors by introducing each of you today. I'd like to welcome Dr. Madhumitha Krishnan, who's a capable Ayurvedic pediatrician and a certified childcare educationist who brings integrated approaches to treatment and research in children. She completed her Bachelor of Ayurvedic Medicine and Surgery from Sri College of Ayurveda Science and her Master's in Kaumarabritya from STM College of Ayurveda, Hassan. She holds a medal and certificate for A grade in Kaumarabritya. She has introduced Ayurvedic pediatrics while working with Aster Hospitals. Presently, she's working as a consultant at many clinics and has worked as a blogger, interned at many prestigious institutes and centers. She's conducted many sessions and presentations on treatment principles of cerebral palsy, an introduction to Ayurveda pediatrics at Aster CMI Hospital, integrated dietetics in pregnancy and infant care, integrating Ayurveda and nutrition, Ayurveda in toddlers, newborn care in Ayurveda, diet for the child, and Prasanna. She's published many articles and has been acknowledged for the best paper on understanding cerebral palsy. We welcome you, ma'am, today. And next, I'd like to introduce Dr. Aparna K. Padmanabhan, who is born into an Ayurveda family which operates a traditional Ayurveda Panchakarma hospital in Kerala. She grew up under the guidance of her father and mentor, Dr. Padmanabhan, who is an award-winning Ayurveda doctor with an experience of over 40 years. She's completed her 12-year-long study in Ayurveda, completing graduation, post-graduation, and PhD in Ayurveda. She was presented with the Jivaka Award for her outstanding performance in academics. Her post-graduation research thesis on rejuvenation therapies in Ayurveda was awarded as the best in the college. She completed her PhD from India's most prestigious and pioneer institute for Ayurveda, Institute of Teaching and Research in Ayurveda, India. She is the co-founder of Ayurveda Loka at Kerala, Vaidya Ayurveda USA, and a medical director at Purnayu Ayurveda Arogya Niketanam, Wayanad. Next, I'd like to welcome Dr. Spandan Katti. She is India's leading osteopath and craniosacral therapist with over 20 years of experience. With a master's in osteopathy, advanced studies in biodynamic craniosacral therapy, and educated as a scientist, as a dentist, she is a health and wellness expert, life skills coach, and an international certified yoga trainer. She's been associated with the Art of Living Foundation as a trainer since 2007. She is the founder of Dr. Spandan Wellness, a platform for scientific complementary medicine with a vision to facilitate and empower people to take responsibility towards their health. She has treated governors, ministers, celebrities, and Olympians across the country. She is the head of PACT Asia, which is Pacific Association of Craniosacral Therapists. She is a senior tutor with the Body Intelligence Trainings UK. She heads the Department of Osteopathy at the Sri Ayurveda Hospital and Research Center, Bangalore, and is also visiting faculty for the Department of Osteopathy in Sri University, Odisha. She firmly believes in practicing scientific evidence-based medicine and has presented papers and conferences on osteopathy. She enjoys being a mother and playing with her toddler at other times. We welcome you, ma'am. I'd like to introduce Dr. Sharon Samuel, who is an Ayurvedic doctor and educator who specialized in Ayurvedic obstetrics and gynecology. With over 15 years of experience, she has helped 500 plus women navigate childbirth and postpartum with Ayurveda. She is currently heading the Department of Ayurvedic Obstetrics and Gynecology at Ashwini Ayurvedic Medical College, Tumkur. Her expertise includes holistic transformation therapy, mental health and family therapy, and yoga advocacy. She's the editorial board member for Council of Ayurveda Research USA and Women's Yoga Council of India, the Karnataka chapter. She works on fertility, adolescent and menopausal adaptations, hormonal dysfunctions, menstrual issues, psychosomatic disorders, and helps women identify gaps in their well-being. She's been presented with the Ayur Visharada Award for Excellence in Ayurveda. She's a published researcher, resource person and speaker, and an editorial contributor for the Council of Ayurvedic Research. We welcome you also today, ma'am. I'd like to introduce our next speaker, Dr. Lakshmi Prasanna, who has completed her bachelor's in naturopathy and yogic sciences and has pursued MD in clinical naturopathy. With passion to teach and spread the importance of naturopathy lifestyle to the younger generations, she started her career as an assistant professor in one of the esteemed yoga universities in Bangalore. She is inspired by her parents who have shaped her to be a strong follower of naturopathy principles. She has completed certification courses in prenatal, postnatal yoga therapy, Garbha Samskara, menstrual education, infertility counseling, sound healing, and Reiki healing. Currently, she is a mother of an 8-month-old and is helping pregnant women learn yoga online, assisting them in happily delivering their little ones. Our next speaker for today is Dr. Bhramara Madhuri, who is a consultant pediatrician working at King Hamad American Mission Hospital in Bahrain. She has been a faculty with the Art of Living for the last 16 years and has helped many transform their lives. Having completed her MD and MRCP, she believes in holistic health. She was a topper right from her school and has won 5 gold medals during her MBBS study. She was awarded as the best outgoing student during her post-graduation. Being a full-time pediatric consultant, she devotes the rest of her time to being an Art of Living faculty teaching yoga, breathing, and meditation to all age groups. She is a 200-hour certified yoga teacher, a teacher of Little Angels program, Art Excel, Yes, Happiness program, Sahat Samadhi, Know Your Child, Know Your Teen, and an intuition process teacher. She's been practicing the Sudarshan Kriya and meditation for the last 24 years and is passionate to share this profound knowledge with as many people as possible. We welcome you as well, ma'am. Our next speaker for today is Dr. Divya Rangrej, who is an expert Nadi Vaidya. She is a faculty member at the Art of Living and conducts many programs. For over 6 years, she has been conducting various seminars worldwide on preconception to post-delivery and has an expertise in preconception to postpartum care. She also conducts Ayurvedic diet and lifestyle-based health sessions for both kids and teens. Dr. Divya is currently working at the Shrishi Wellbeing Center in Surat, Gujarat. We welcome you as well, ma'am. Our moderator for the day is Dr. Sharika Menon, who is a senior consultant, an expert Nadi Vaidya, facilitator, and a trainer of trainers at Shrishi Wellbeing. Currently, she is heading the research wing of Shrishi Wellbeing. She has been associated with the Art of Living for over 25 years and is an Art of Living teacher. She has worked as a health and wellness consultant in many countries. She's been training many doctors in the field of Nadi Pariksha and Shrishi Marma. She's the resource expert and trainer for various programs on increasing awareness towards Ayurveda and wellness. She is also a teaching faculty for Ayurveda at the Shrishi School of Yoga. We welcome you as well, Dr. Sharika, and over to you for beginning today's wonderful session.
Thank you. Thank you so much, Dr. Sharon. And I'm very glad that we have all gathered for this on this occasion of World Health Day. And we are talking about happy mom and happy child. So when we started discussing about this topic, how this came up was how a child grow up to be a happy adult. And then so many factors come into picture. So we traced back not just the growing phase, right from the time when they are conceived, even before that, how the mental status or emotional status or health and well-being of the parents, and so many other factors that contributes to this. And then when we spoke to this about this to Hanuma, Gurudev's sister, so she said, no, when there is a happy mom, then there is a happy child. And that beautifully put this whole theme of this discussion, this conversation together, and it just came out very beautifully. So we will be exploring various aspects and holistic aspects where we can bring up well-being as well as happiness in mothers and newborns. So I would like to start with you, Dr. Aparna, where we are going to look at the situation, current situation, where there are several mothers. You have been frequently seeing many mothers who are struggling with postpartum, depression. And I'm curious to know, like, some common symptoms or behaviors that you observe in these patients. And have you been also been able to identify any key issues? What are the causes that seem to contribute to this condition? Dr. Aparna, I think you are on mute. Can you check your audio? Yeah.
Hi, namaste. So, every woman, no, goes through a series of profound changes during her lifetime. When we tend to ignore this natural transition and don't help the body and mind, then the imbalance occur. And Ayurveda has given proper guidelines for us to navigate through these challenges. And through each of this change which is happening in the body, we need to be very aware and attentive. And there are special practices to support her journey. So nowadays, what I see is a lot of stress, a busy lifestyle, wrong diet and lifestyle choices, lack of stress management. These are the major culprits in deterioration of the health in many women. And many women, unfortunately, nowadays get pregnant not at their peak of health. This is also affecting the quality of pregnancy and also the motherhood. And I'm consulting many who are struggling with inflammation, impaired gut health, messed up menstrual cycles, failed IVFs and IUIs, and all this also contribute towards poor physical and mental health. So the ordeal in which they are going through a lot of fertility treatments itself can take a toll on the mother. So I think poor mental health is one among the top causes for postpartum depression. And recently, a woman in her 30s from a metro city consulted me online, and she had a lot of joint pains, inflammation. She could not eat, she could not digest food, and she had history of two IUIs and one IVF, and she was waiting for her next IVF in next month. So I said, can you wait till your body settles a little bit, cleans up a little bit, and do some diet and lifestyle corrections and do some stress management protocol so that you can make sure that you are in the best of your health. So, and I explained why gut brain axis needs to be corrected, why high inflammation needs to be addressed, how to eat right for her condition. So, but unfortunately she said that she has already paid for the IVF session and she has to be there. So uh, and then after this after then I could help her with her acidity and gut bloating and all that. But then she got pregnant with IVF, and then she was doing the whole protocol, and then she came for postpartum postpartum care. So by the time she had same inflammation which is worsened and constant aches and pains in the body, she was tired, she was not happy, and 6 years of wait for the baby, she was not able to enjoy the motherhood. So these are some of the symptoms of postpartum depression, like not feeling the bond with the child. You feel empty and alone despite of having added the dream of a baby to her life. She was like this, and then completely overwhelmed, and lot of people advising what to do, what not to do, and not able to produce enough milk. And then people are overwhelming her with advices, and she feels that she was not a good mom. uh, she was not producing the enough milk, and she was angry at herself, her husband, and the baby, and there was no bond or connection. Constantly she was irritated and angry and not able to sleep. So these are some of the symptoms which I constantly see in my practice, and I feel a proper planning is very much needed, emotionally, mentally, and physically. We all need to be ready to receive or ready to be a mother. So then only we will be able to have a quality life. That's what my experience shows me.
Yeah, very nice. So, as you were mentioning, many times these mothers are upset with the other half, the husband, who is not able to contribute to the caregiving for the child. So, Dr. Sharon, I think the next question will be to you. So, very often we see the mother becomes the focus of, for the care for the child, and that places that excessive burden of child care on her. So, in Ayurveda, we have discussed so many times like about matrija pitrija bhavas. So, where it highlights both maternal and paternal epigenetics. So, given this context, what specific role do you think that fathers will play in this? And especially with childcare and their development, what is your observation?
Like Dr. Aparna was saying, the focus on physical and emotional and the immediate social influence on the pregnancy has to be taken care. In that, if you see, not just the mother, but the father also has to be mentally and physically prepared for the pregnancy, and the immediate caregivers too. Okay, probably we could discuss about that later. But when it comes to paternal input, it starts right from the contribution of the genetic material. That is right at the time of preconceptional care. So it starts from there. So the role of the father is at the time the genetic material is transferred. So preconceptionally, the father has to be prepared to make sure that the concept is healthy and able to navigate through the entire pregnancy without any defects. So that is the Pitrija Bhava that we are talking about, not the Prakriti and the Pitrija Bhava. So whatever Prakriti that the child acquires has equal source from the mother and the father. And so most of the times now, especially in today's times, we're seeing the mother is put through all of the uh, pressure of conception. Even if it's an IVF, it's all on the mother. And a few husbands are, voluntarily being a part of it, but majority of the population is still doesn't understand that the sperm quality plays a very major role in the DNA transfer. And that is going to determine how the first trimester goes by. And that determines how the rest of the pregnancy is going to be. And that contributes to how the baby is going to be after birth. And like you said, as an adult, how he or she turns out to be depends a lot on the father's genetic material as well. So in Ayurveda, when we say preparation for pregnancy, the Garbhadana Samskara, whatever happens before we plan for pregnancy, the equal preparation is there for the father as much as for the mother. So the role of the father starts right from there, and that continues through the pregnancy, and it should ideally also continue during early childhood, which will, of course, have an impact through the rest of their life. So, during pregnancy, if you ask me, it's about the father is the immediate, the closest social circle of the mother. So, the fetus is listening to the mother all the time. And the next immediate source of anything, sound, knowledge, information, love, everything is coming from the father, because he's the only person who's going to enter that circle, personal circle of the mother. So, embryological study it has shown. Studies have shown that the sound that the fetus hears from the father is different from the way it perceives sounds from the rest of the human beings itself. So, how the father interacts with the mother and how the father interacts with the child during pregnancy is going to impact the emotional responses of the child during the rest of his or her lifetime. And immediately after childbirth, of course, the role of the father has a major impact on how the mother copes up with the depression, like Dr. Aparna was saying. And also it has an impact on how the child cognitive development
and also how the child learns to interact with different people has a the impact of the father is very, very significant. So it's always the burden comes on the mother. But if people are able to understand that the father plays an equal role, then probably it can change the way paternal contribution is considered in our societies. And if that is understood in the right manner, the families can also facilitate this. And when families facilitate it, things become a lot more easier and also a bit more streamlined as well, which is always there in our cultures and which is always mentioned in our mentioned in Ayurveda as well. It's just that the implementation has probably been lost over time, and I'm hoping that we can bring it back for everybody's well-being, for the mother and the child and the family.
Yeah. So actually, I have a question to Dr. Spandan. It's in similar line, because she was, when I was speaking to her, she was mentioning about some interesting cases where whatever you mentioned right now, it's perfectly fits in what she was working on. So, Dr. Spandan, you had previously mentioned about this observation, about how the father's presence can normalize and ease the birthing process, even in cases like cord around the neck. So, will you please share that experience with the audience?
So, in osteopathy, we usually do body work. So, we work with our hands, and the importance of our work is connecting with the deep fascial connections. So, the fascial connective tissue has a specialized sense of sensitivity called interoception. So, interoceptors are receptors that respond to a safe, light touch. Now, like Dr. Sharon just mentioned, the baby is used to listening to the sounds of the mother. So the movement of the bowel, the beating of the heart, and then the change in the beating of the heart with the change in cortisol levels. But we also know that the child can start hearing from the 7th month. The auditory apparatus is up and running. So then an external sound of the father then becomes very important. And that in our culture has been inherent in, the fathers telling stories to the belly of the mother, singing songs or going for satsangs or even touching. So basically, when we work with pregnant women, I make sure the fathers are present and the father is touching the belly of the mother. So when that is happening, we can in the late third trimester, you can actually see the baby moving towards the father's touch. Like literally, there is a shift. The fetus moves towards the father because children are very conscious beings even before they are born, and safety is a very big aspect for a baby. So there are osteopathy is also a bunch of philosophies. So and one of the schools of thought is that unless the baby feels safe enough to come out, it will not initiate labor. So the baby has to know that it's going to come out, it's going to be loved, nurtured. And I think there the fathers play a very big role because especially for first time moms, it's a total freak show. Like, Dr. Aparna was also saying, if there has been a previous loss, so many people around telling multiple things to do. And then the whole fear of the pain and the whole process by itself, the fathers can then become a very strong anchor and support for the baby and the mother, because the moment the father moves into the scene, not only does the baby hear the father, the mother's heartbeat also slows down, her cortisol drops, and there is this sense of deep safety that the babies resonate with. In fact, there was a case where Dr. Sharon had asked me to come and see a lady where the baby wasn't descending, it was, and the movement shifted, and we had some very interesting cases in the Ayurveda hospital. um, Possible indication for surgery because there's a cord around the neck. Mother was very scared. Father had not even bothered to connect with the baby because it was a total woman show. Mother-in-law had stepped in, mother had stepped in. So I made them touch their wives' bellies. And they were shy. It was so cute. They're like, no, 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 I'm not going to touch. I said, listen, you created this being. Touch, connect. And suddenly the whole space shifted. So the mother settled down so beautifully that 6 out of 6 went in for normal births. So I'm not saying that it was only because of osteopathy or craniosacral, but what I definitely saw was that the state of the mother, her mental state, her spiritual state really settled. And suddenly, they felt like they were not alone anymore. The husband was with them on the journey. So both the partners took equal responsibility. Even the father's expressions, they were like, "Oh my God, did the baby move?" I'm like, "Yeah, that's the that's the baby moving." So when we do treatments for pregnant mothers, usually they come in with lower back pain, a little bit of anxiety, and we do very gentle work. There is no manipulation involved. It's just a very gentle, safe touch and a safe space. And I really see the mother and father bonding, because fathers deal with the anxiety of the childbirth usually by switching off. And the mothers are then ki bhai kya karu main, where am I going to go? I need a little help. So the moment they aligned and streamlined, the babies were able to pick it up. So there are recorded cases in osteopathy of also the babies who were breech, turning over and moving into a normal position, mothers having comfortable labor, no complications. And even if they did, they were able to move through it with resolution. The remnant trauma of "I was alone, I was left" wasn't there. So they're like happy parents, happy baby. So I think integrated medicine today is like a big call. It's an unheard call globally, where we need to move in integratedly, tailor make requirements for the mothers and the babies, because every form of medicine has something very beautiful to offer. So we need, and that's why this platform is also so amazing. I wouldn't have met any of you unless it was for this call. So I think it's a very dynamic, conscious relationship we see, which is very aware. It's pure consciousness, the baby, and they resonate with the external environment. So I think fathers really need to step up, and they need to be applauded also. Sometimes they're like, "I don't know what to do." It's a little guidance for the fathers.
Thank you. That's wonderful. So we had looked into all these aspects. I want to add few things that influence birthing health, baby's health, development, even the mother's health. So coming to Dr. Madhumitha, Doctor, based on your, like, whatever discussions we had, so many factors influencing this. So as a dietetics expert, specialized even in pregnancy care, what are the key aspects of diet and lifestyle that a mother should prioritize? And also considering the popularity of all this, our Masana protocol, can you please highlight its benefits for all the expecting mothers?
So I think when you look at a pregnant woman, it's a very interesting theory which is there. It's actually written by WHO. So the minute it comes from WHO, everyone listens, right? So WHO says that the first 1,000 days are the most important for the development of the child, right? And in that, it is from conception till the baby is 2 years old. So once the baby is born, yes, we can nourish them, we can give them foods, all of that. But we forget that the pregnancy is the most important one, because that is like the child is getting nourished from within the mother. So the mother's diet is so important. And I think it's so beautifully written in Ayurveda, where it says each month. So this was a exercise which I did to kind of understand why we had these different, specific diet which is given month-wise in the Masanumasika, where in the first month they say, the first 3 months, generally they say it needs to be basically liquid in nature, sweet in taste, something which is very nourishing, and so on. So if we see from month-wise, you see a lot of milk which is used. Milk and milk products. There will be primarily milk, then milk which is processed with specific herbs, or you have milk which is processed with medicated ghee, then you have butter, you have curd. So now in the present day, there is this whole confusion about milk and whether it can be consumed or not, because people are having issues with lactose intolerance and so on, which is a topic for another time. But when I was trying to understand the relevance of why Ayurveda was talking about this, there is something in dietetics which is called as the bioavailability of protein, which is basically to say, when we have any source of protein, how much of it is actually going into our system. So there was actually a mother who had come to me and she was very, very upset. I said, what happened? This is such a beautiful time in your life. Why are you so upset? She says, they're expecting me to eat 80 grams of protein in a day. Where do I get it from? I'm a vegetarian. And how much of a soya or this paneer or what can I have to, achieve that amount? So I was just talking to her and I said, okay, so what kind of a diet do you eat? It's not that vegetarian sources of protein are not great. So you can definitely have. So if you see the major sources of protein in the food groups which we have, of course, milk and milk products is one of them. The second one is meats, which not everyone consumes. And the third one is basically the dals and pulses. Now, if you see in the Ayurveda perspective, dals and pulses come under the Vatakara category, which generally we would not suggest too much during pregnancy, because we're like, if you have too much of a Vatakara nature, that's going to affect your digestion. It's going to affect the growth of the baby. So be careful on that. And the second, meat also, people are not very comfortable because it is Pitta Karak. And Pitta Karak is also not something which we want excessively during pregnancy. While milk is something which is primarily Kapha Karak. And we know that it is something which is nourishing, anabolic, something which supports growth, nourishment, and so on. So yes, in that way, I agree, milk is something which is good. But this bioavailability answer was so beautiful. So in the bioavailability, if we see of these three sources of protein, unfortunately, dals and pulses, if we see, only 50% of that is protein. The other 50% is carbohydrate. And even in that 50%, we're not able to assimilate it completely. Okay. So then meat is a great source, but because it's Pitta Karak, nobody will have too much of it. So then you have milk, which is amazing because the whey protein is actually 90% bioavailable as compared to all the other proteins. That's why when people are looking for sources of protein, they say go for whey protein because it's so easily assimilable to the body. So I think this is where fundamentally Ayurveda was so perfect in its diagnosis to say that milk is something which can easily be given to the individual in different forms. In the initial form, you just give it as 100 ml as raw, I mean, of course, boiled and cooled milk. But when she is nauseated, she is not able to have too much of food, etc. Just that little bit of milk is something which will soothe her, which will make her feel good. And in that small quantity, it has sufficient calories to support her. In that second trimester, when she's, she needs to gain weight, this is another major issue for most parents or especially women. In that second trimester, they're like, I'm losing weight. I don't know what's happening. I'm supposed to be having 1 to 2 kgs and I'm nowhere close to that. I don't know what to do. At that time, you give them like the curd and the butter, which is explained in the classical text. Both of these are considered to be ruchikara, something which improves the taste and enables the mother to eat better. And then you give, of course, processed milk, which is also helping in better nourishment. So that's what, and in the last trimester, she comes up with constipation. She's feeling so tired. She doesn't have energy. And of course, the child is gaining maximum weight at that time. So again, giving milk in that processed form with medications is a great way to get it to the child. So that's where I think this whole Masanumasika was so beautifully thought out. And if you see specifically in the 6 months, there is a reference of using Gokshura, which they say you process it with milk and give it as a Gokshura, Kshirapaka. So this again, I was like, why specifically in the 6 month? And it's very interesting because that's when, because of, there are chances of her going into preeclampsia because there can be higher blood pressure which comes up. There'll be swelling. She's feeling a little heavier because there's more fluid which is there in her. So to prevent that, they've said before itself, you have the Gokshura to prevent this from happening. So like that, each thing which they have possibly conceived, they said, if you follow this, then automatically you're going to have like a healthy child at the end of it. And it doesn't end with pregnancy. That's the beauty of it. They say post-pregnancy also during lactation, they understand the importance of the diet there. So they say you need to have foods which are stimulative to the digestion. Many of the couples which I work with, I ask the parents, so did you follow, these traditional things which they give you, the laddus and this one? They're like, oh, they're so full of ghee and spices. I can't do all of that. I didn't have it. I'm like, but that's the most important thing, because it's stimulating your digestion. It's helping you digest the food which you need to have post that. And so many of them develop digestive issues. They have like gas, bloating, constipation. And I'm like, if you just had that laddu, half of these issues would be sorted. And of course, even lactation itself becomes an issue if they don't have the right kind of food. Because even though, traditionally people say it's, I would say, a myth, definitely, that during pregnancy, you need to eat for two, right? So I'm like, just think about the calories which you're talking about, right? 1,500 or 1,200 calories is normal for a pregnant woman. And in addition to that, they say, okay, add 300 kilocalories for one child. Now, 300 kilocalories versus adding 1,200, that's 4 times the quantity. Who can eat that much? That's ridiculous, right? While in the postpartum phase, when their metabolism is so high, they're so focused on losing weight, they're not eating. I'm like, this is the time you need it. Your metabolism is so good. Have whatever you want. You will just like evaporate it in the exercise which you're doing of feeding that child. So, and even now in the preconceptional time also, people are coming to us asking, what are the kinds of food which I need to eat to help me get a healthy conception? And this was also explained in our classical text, where they said a woman needs to have sesame, urad dal, etc. to stimulate the right kind of hormones, the agneya aspect in her, while the male needs to have the ghee, the milk, etc., which helps in promoting that. So from the conception, they have added the diet aspect to it, and lifestyle comes as a part of it. So they say whatever is good and something which is satmya or suited to you, follow during your pregnancy. While in the post time, be very, very careful, because if you're doing the wrong kinds of activities, they can negatively impact the development of the child. It can negatively impact your health post the delivery time.
I'm sure the child is very happy with all the milk and butter and curd.
Yeah.
So I had a case recently who she suffered with chronic, very severe acidity post delivery, and she had complications also during delivery. And she was mentioning that um, she was not allowed to practice any dietary restrictions, all whatever we discussed now, even yoga. So that is why the next question will be for Dr. Lakshmi. So we are really impressed by your extensive work on women and child care, with around more than like 200 papers published. And as Sharanya was mentioning in the beginning, Dr. Lakshmi is also a mother to an 8-month-old baby girl now. So given your expertise, I would love to know your perspective on integrating yoga practice with conventional maternal care in Ayurveda. So we also have at Shishi School of Yoga, we have many trainers focusing on pregnancy yoga. So our Dr. Bhramara is also one of them. And then as I said recently, the patient who came, I was surprised to know that her gynecologist strongly opposed yoga practices right from the first month. And she had developed so many complications during childbirth. And post that, it took so much of time to recover, including gut health and other issues also. Now, what are the benefits of practicing yoga, and how can these practices easily be incorporated? And do you have any recommendations on trimester basis or monthly basis, like how Dr. Madhumitha was sharing now? Do you have any inputs on that?
Yeah, basically, we have to understand one important aspect here. This is something told by Dr. B.M. Hegdeji while I was in my final year of BNYS. Whatever medicine, it can be Ayurveda, conventional medicine, naturopathy, or yoga. So we should never construct walls between the systems of medicine. We should always build bridges, because at the end of the day, what all of us want is the well-being of the client. We are not here to fight amongst ourselves. No, my system is the best or their system is the best. So as a professional, I have been believing this, the concept of integration, especially when it comes to women health and pregnancy care. I've been working with one of the very good and best Ayurveda doctors in the city, where she'll be practicing Ayurveda for the pregnant women, and I will be teaching yoga and naturopathy part to them. Secondly, what I have noticed from my student days listening to, one thing which happens with medicine is, soon after we join to the medical school, all our relatives, all our friends will just bash us with various questions saying, this is the disease we have got, this is the problem we have got, why don't you check with your lecturer, why don't you check with your doctor? So the common thing which I have heard over the years is, my gynec didn't allow me to practice yoga, or my gynec didn't wanted me to go for normal delivery. Trust me, being a health professional again, we should never talk ill about any other health professional. Today, what happens when you compare any alternative medicine like Ayurveda, naturopathy, yoga with conventional medicine? Conventional medicine believes that public believes that medicine will treat them, doctor will treat them. Whereas alternative medicine believes that body heals itself. So if we don't have this understanding, we tend to blame the doctor who is in front of us. Say, I've got this problem, so you are whole and soul responsible. That might be one of the probable reasons for gynecs not suggesting them yoga. But again, there are various factors to be considered. The case of miscarriage, previous miscarriages, the case of previous abortions, MTPs, or some psychological issues with the client, as one of you were mentioning, low lying placenta, short cervix. In these cases, generally gynecs will not suggest yoga. But secondly, we all know pregnancy is divided into 3 different trimesters. In first trimester, we don't encourage them to practice asana, because yoga is not confined to only physical body. It is not the asana to flex, flexing the body, reducing back pain. It is not just the body there. So first trimester is the time where the mother is so much anxious about her pregnancy, what has to be done, what should not be done. And she's new, so many changes happening in the body, so many hormonal changes. The first trimester, we don't emphasize upon practicing yoga, asana, joining for the session, or going somewhere for holding yoga mat. It is all very simple. We just ask them to relax, practice minimum pranayama, meditation, just be with themselves. As per Garbhajnana, Garbha Yoga, it is said that the consciousness comes from the time of conception. So we believe that the positive mindset from the time of conception, from the moment she get to know her, UPT is positive, we encourage her to be positive. We encourage her to have positive mindset, calm mindset, composed mindset. So it is not only about asana, but once she enters second trimester, obviously we can start with asana practice. So as per integrated yoga therapy, the human existence is divided into Annamaya, Pranamaya, Manomaya, Vijnanamaya. Let me not talk about Anandamaya because it's a very vast topic. So coming to Annamaya, generally we ask them, encourage them to eat Satvika Ahara, as one of you said, Madhumitha madam, regarding the importance of eating Satvika Ahara, good amount of fruits, vegetables, so that they will not end up with acidity, gastritis, constipation, etc. And when it comes to asana part, we generally, very common thumb rule, soon after client becomes pregnant, no bending forward, no twists, and no lying down on the abdomen. No jumping or anything which is vigorous is generally avoided. And the second thumb rule is the importance of their everyday. It is not about what they do on the yoga mat, but generally their postural modifications. How do they sit? How do they stand? When they sit on the floor, how do they get up? When they lie down on their bed during the night time, how do they turn to the side and get up? All these things we generally teach in all yoga sessions. So based upon the trimester practice, again, it's about not the destination. Too many posters today. You want to get your normal delivery done, please join our yoga classes. So I don't agree with that, because mine was a cesarean due to so many other complications, and my baby was a preterm baby. So imagine someone delivers at 28th week, 31st week. We can't go for normal deliveries always. Does that mean that I didn't do anything throughout my journey? It is not like that. We should have we should ensure that our journey is beautiful. With the practice of Ayurveda, yoga, naturopathy, meditation, we should make our journey beautiful and destination to be left to the universe. So what happens here, throughout their journey, they've got so many problems. Can it be back pain, anxiety, sleeplessness, acidity? So definitely there are specific asanas for specific problems. But in general, we say, deep squats not to be practiced at least till 5th month. And then Setu Bandhasana, the bridge pose, which is very good for back pain. We generally do not advise post 8th month. Once the tummy grows a little bigger, we don't suggest Setu Bandhasana as such. But even if it is done under the assistance, we don't ask them to maintain the pose. It is only through the breathing we undergo it. And then soon after they enter their 9th month, we encourage to go for deep duck walking. Our ancestors used to do all this as part of their lifestyle. But again, asana is not just on the yoga mat, but throughout the day, we ask them to practice conscious breathing. The second comes the pranamaya kosha, where yoga believes that there are 72,000 nadis in our body. Any blockage, leads to some improper imbalance, improper blood circulation, and ending up with, restlessness, etc. So regular deep breathings. We ask them to place their palm on their womb and go with deep inhalations and deep exhalations. In fact, this helps even during the time of labor also. While they are in the labor, the active contractions happen. The deep breathing helps in activation of parasympathetic nervous system. You all know about the vagus nerve. How is it linked with? So deep breathing is more than enough to activate vagus nerve, which helps the client to be calm and composed. Many of my clients told this, that simple deep breathing techniques help them to calm down during that time, because there is something called pratyahara as part of Ashtanga Yoga and pregnancy. Patanjali Maharshi talks about pratyahara in relation with pregnancy and labor. It's so beautiful. At the time of active contractions, how is the state of the mind of the lady? Is she thinking about what will be the color of my baby? What will be the qualities of my baby in future? Or is she just working on her body, on her breath, on her, the baby coming out of the womb through the vagina? How is her state of mind is what is pratyahara. Pratyahara means withdrawal of the senses, right? So at that moment, how is she? Patanjali Maharshi talks so beautifully about pratyahara in labor room. So in the labor room, throughout the journey, why are we teaching them yoga? Because we want that lady to get into that phase of pratyahara during her labor. So that comes manomaya kosha. So we teach her to control her mind, control her senses throughout her pregnancy. So there are cravings for sure. None of us are against the cravings they end up with, but they should also be conscious of those cravings. What if they end up eating every day outside, as Madhumitha madam said? So it is, we cannot, the first 1,000 days are very important. Unfortunately, everyone thinks 1,000 days after the baby comes out to the external world, not about what happens inside the womb. So Manomaya Kosha talks about the mind of the mother. So we teach them gratitude techniques, journaling, and then few affirmations, talking with the baby in the womb, Garbha Samvad, communicating with the baby in the womb. So these techniques will help in Manomaya Kosha. Then comes Vijnanamaya Kosha, the wrong knowledge. So many people tell me, Prasanna, it seems this asana is wrong. Am I right? I'm like, where did you hear? YouTube channel. Okay, see, I've studied, I've spent some time for my studies. My parents have spent some money for my studies. So if you trust me, you come and pay for me. If not, no. So I gently say that because we have so much knowledge in the Google today. So wrong knowledge is more than the right knowledge. So Vijnanamaya Kosha talks about Sajjan Sangatya, listening to the proper discourses of people, listening from the right people, learning from the various books, what is right, what is wrong, because Vijnana is something which is there for human beings. It's the gift for human beings, which is not there for animals. We know what is right, what is wrong. So this is how the journey of yoga, generally we emphasize upon to a pregnant woman. Not every time the asana there, because there are so many complications like preeclampsia, gestational diabetes, as I told you, short cervix. We can't teach them asana every time, but there is pranamaya, manomaya, vijnanamaya, which we have to definitely emphasize upon to deliver a healthy, happy child. And I strongly believe a healthy mother can deliver a healthy child, and a healthy mother can create a healthy society.
Nice. So, you were mentioning about many complications that can arise during the pregnancy, post delivery. So, coming to Dr. Sharon again. So, in line with what our doctors were sharing, I want to explore some topics like Garbharaksha and Sutika Paricharya with you. So, very often this postpartum care becomes a less priority, lower priority for all the new mothers who are balancing so many roles, no? And increased responsibilities. So, can you please share what a mother's lifestyle should ideally be after childbirth, especially, and even during the pregnancy? And what is the role of the family in supporting her recovery?
So, Dr. Sharika, like you rightly said, this is a space where I'm, clinically, I am finding myself in a very helpless spot because it is as there is a limit to what a physician can do for a patient, right? Rest of it is what they have to do to balance their lifestyle, which they don't put on priority. Like you say, once the baby is out, then the woman is immediately back to her regular lifestyle. But it is not just traditionally or physiologically impossible, but uh, it is practically also impossible. And when you force that on the mother, what we see is the series of complications that we have, not just in the postpartum period, but even days and years after that, we see complications. So I see mothers with breastfeeding babies who have to work because their project or their particular role demands that, even if they are in their maternity allotted leaves also, they are still thinking about work, or they're already working in their spaces in their houses also, and they are in extreme stress that they are not able to give themselves to the baby, neither to themselves nor to the job that they are doing. So it's basically they are fragmented in all spaces, and so when they fragmented, of course, they'll end up having issues, which is like a mess, and then we have to undo bit by bit by bit, where I do feel helpless at many times because I'm trying, they are trying, but the thing around them, because we are human beings, we are interconnected with, yeah, we are interconnected with everyone. And so just one person trying or another person trying is not going to complete the thing. So, like you were just asking me now, I really want to stress upon the fact that care of the woman has to continue after delivery. And in Ayurveda, the time period, it's not very fixed, but it averages somewhere between 6 weeks to, can go up to 4 months to 6 months, or till the mother is feeding, actively feeding. It can go up until then, depending on the health of the mother and the health of the baby. And this period involves, it's no, traditionally people believe it's about massages, so that's what most of them do: massage for the mother, massage for the baby. But it doesn't end there. And I'm sure Dr. Madhumitha would also know a lot about it. But like it doesn't end there. There's a lot of things that we need to do to support the mother in order to ensure the baby's well-being and her own well-being, and that, so that she continues to remain the woman that she wants to be. And that involves medications, that involves counseling, that involves support from the family as well, which is where what you said comes into priority: the immediate family, and that is the husband, and the primary caregiver of the mother. Like we say, we always talk about the primary caregiver of the baby, either the mother or the father, whoever it is. But who is the primary caregiver to the mother? Because Ayurveda says she becomes shunya sharira. No, inside her body she's empty, and inside her mind also she's empty. She's just given something from her body outside. How is she feeling with him? She is actually weak, and she is sukumara. She's tender, and she needs care from an external source. She cannot give it all just because she's an adult. She's still not able to take care of herself. So the husband and the immediate caregiver, it could be the mother, it could be the mother-in-law, it could be a friend, it could be a close relative. Whoever is giving that care should also be invested in the mother's health as much as they're invested in the baby's health. And when this is understood in its right sense, not just as a formality or a traditional practice. Some cultures do it because they have to, some people do it because they want to, but most of the times the knowledge is not complete. So if if people were taking interest, and now I feel that many are taking interest, and I want to encourage all of them to take the right kind of information from the right kind of people and do the right kind of practices. And now Ayurveda is growing. There are many who are available out there to provide the right kind of information. And when we do that, then the pattern is set. And I've seen the women who take Ayurvedic support during pregnancy and after go on to be healthy and happy mothers. So they are happy. If you talk about their pregnancy years later, they talk about it happily. They are very content with what they have done, and they're content with the way their child has been raised. And I feel that is what is most important. It's not about what kind of luxury setup you deliver in. That's not the only thing, but it is about the kind of luxury that you receive at home. I think that matters the most. And for that, for everybody, like I said, all of them should invest in that immediate postpartum care. So it's not just about the baby, it's definitely about the mother, because a happy mother, happy child. That's the way it goes. Yeah.
So we have a lot of people watching us live. There are some comments and everything coming up, and they're all enjoying it. They want more perspectives and more information on that, but we have limited time. Anyway, we will keep discussing further. So, Dr. Sharon, there is a follow-up question to you. So we are also curious to learn more about your experiences with certain cases, like Dr. Spandan was sharing about the cord around the baby's neck. So how did you manage cases of placenta previa, or if any other cases that you want to share that people need to be aware of?
Yeah. So when it comes to obstetric complications, I feel that's where the knowledge of an obstetrician comes into place. So because otherwise, childbirth is a very normal physiological process. So understanding the complication and intervening at the right time is our job. And that's what we do. Like, for instance, if there's a complication with respect to placenta previa, depending on what grade it's in, we interfere. It could be accelerating the process of labor, or, considering surgical intervention. It will depend upon how the well-being of the child is through the process of labor, and also through the times of pregnancy that they have been in. So there I feel the right kind of decision making is important, and we have done that in multiple cases. Now, when we talk about the role that all of these things, but because we're talking about child, pregnancy care and all that, what role can these things play in enabling smooth sailing through these complications? So if the complication is manageable, if the physician feels so, like, for instance, one case that we delivered, cord around the neck, we have delivered cases sufficiently enough for me to say that it's not impossible. Placenta previa, I really cannot comment on it that way, because it is it's a matter of serious consideration. Cord around the neck, if the fetus is healthy, there is no fetal distress through the process, and if all other parameters are suitable through the partograph is going normally well, then we have been able to deliver babies with cord around the neck as well. But in such cases also, I would say, it's possible only if the mother has been under our care, like if she has followed the Garbhini Paricharya appropriately, taking the right kind of ghee and girdas and kshirapaka through the delivery, and we know that her apana vayu, that is the vata, is moving in the right direction, and if she's healthy enough, and if we know that this baby can actually slip through that pelvis and that vagina, then we are able to ensure that we are able to deliver a quarter of the neck baby. But in placenta previa, I wouldn't say that, or other complications, it's not really the same for everything. But if we undergo preconceptional care the right way, we can definitely reduce the incidences of these complications, like the placenta going down and implanting itself. We can definitely reduce the incidences of these complications if preconceptional care is taken into consideration. That is something I can assure. But yeah, the rest of it, I think it's very subjective. Depends on fetal maternal health and also what kind of setup we're delivering in and all these things.
Mm. Thank you, Dr. Sharon,
Yeah.
for insights. So now we'll come to a different perspective for the newborn. So, Dr. Bhramara, you are someone who's actively promoting and supporting breastfeeding and often educates others about its benefits, advocates policies, and support breastfeeding mothers. So, what are your thoughts on the bond that is created between a mother and her newborn? Their connection goes beyond just milk itself, isn't it? So, can you throw some light on that?
Yeah. Breastfeeding is considered the single most important factor in the health of a baby. Not just the health of the baby, the health of the mother as well. Right? And we as caretakers need to do everything possible to ensure that the breastfeeding continues. The WHO says a minimum period of 6 months, but then we understand that it goes beyond that. And up until at least 2 years, a minimum of 2 years, if the mother can be encouraged to breastfeed, that will be the best seed sown for the baby and the mother. Now, in my practice, I find that most mothers, they tend to take the convenient route. Within the first 1 month, which is the most important phase when breastfeeding has to be continued without the introduction of formula feeding, mothers tend to start 1 and 2 and 3 bottle feeds, and that actually diminishes the breastfeeding. And before long, by the time the mother comes back in the second or the third month, there's so much of more bottle feeding happening that breastfeeding takes the backseat. So there are 4 important aspects that I tell breastfeeding, especially first-time mothers that come to my clinic, is number one is to have a strong intention to breastfeed, and this has to be right from before, right from when the mother is pregnant. In fact, the gynecologist is the one to start off this concept of breastfeeding, tell the mother how to take care of her nipples. Second is the mother has to feed well. She has to eat well. I tell them, what does a dairy cow do? Eat grass all the time. You don't need to eat grass, but every time you're hungry, you just have to eat. Make sure you hydrate yourself and eat healthy. Third is to feed well. Unless the tank is empty, the tank will not fill up. So, breastfeeding, direct breastfeeding. And I'll come to the bonding aspect in a little while. But emptying the tank, letting the baby directly breastfeed has so many advantages. And then finally, the mother has to sleep well. Very often we notice that the mother is a new mother, especially a first time mother, is so overwhelmed by the new role that she takes on. And she's so busy changing nappies and feeding, and she's so exhausted. And we know most babies in the first 3 months of life, they have a reversed sleep cycle. So they sleep more during the day, less during the night. So the new mother, actually ends up losing out on sleep. But we know most of the hormones, growth hormone and everything, they are secreted during the sleep phase. So one encouragement to the mother is to say you feed the baby and sleep along with the baby during the day so that you stay awake for the baby in the night. Now, coming to the aspect of bonding not just from the skin to skin contact, when the mother takes the baby onto her skin soon after delivery, that has a huge impact. But every time she holds the baby and feeds her, this secretes this beautiful hormone called the oxytocin, or the love hormone, that encourages love, trust, and security, attachment that naturally develops between the mother and the baby. And then, with respect to the baby breastfeeding, suckling at the nipple, there is this other hormone that is secreted, the prolactin, which not only helps the breast milk develop further, it also is an anti-cortisol effect. Both oxytocin and prolactin are known to be anti-cortisol, anti-stress hormones. And therefore, they naturally take care of the little bit of sadness, anxiety, and probable postnatal depression that the mother might go through. So these encourage not just bonding, but then the attachment And prolactin is also called a nurturing hormone. So the mother, a new mother who is still then just pregnant, like Banu Didi mentioned, she is also becoming like she delivers a baby, she is also getting into motherhood for the first time. So the prolactin helps in developing that nurturing ability in the mother. And therefore, she's also sensitive and attentive to the cues of the baby. The baby doesn't need to cry out loud before the baby mother picks up the baby and starts feeding. Just a little wiggle here and there, a little bit of kunkui is enough for the mother to know, oh, my baby is hungry. And even before the mother puts the baby to the breast, the the release of the oxytocin, the prolactin, actually lets the letting reflex down. And very often, that is why we have nipple pads, right? So these are beautiful aspects of the subconscious bonding that happens between the mother and the baby. And breastfeeding itself is a very sanctified act, which is very meditative for both the baby and the mother. When the mother is just looking into the eyes of the baby, it's and sitting in her own space, not looking, not watching television or busy on the phone, talking on the phone. It has to be a very one-on-one. It's a very sanctified time for the mother and the baby, and that develops that bond which runs through not just that infancy, not just through the time when the mother feeds the baby, but well beyond that emotional connect that happens. The amount of the substances that are there in breast milk, nutrients that are there, that are specific for every baby. They say every baby has unique nutrients that come from the mother. Breast milk is unique to the baby. The omega 3, omega 6 fatty acids, and the HMOs, no matter what different kinds of formula companies try to imitate breast milk, no one can actually come anywhere close to imitating breast milk with respect to the HMOs that promote gut health. And we all know that the gut is the second, in fact, the primary brain, emotional brain, right? So not only does breast milk help in developing the neural connections, the fatty acids that encourage proper and optimum growth of the baby's nervous system, it also helps in them developing their visual acuity, their cognitive ability, that later makes them very emotionally secure human beings. So a breastfed baby, when compared to a bottle-fed baby, is more emotionally regulated, has the trust factor, knows that he or she is being taken care of. And therefore, they develop healthy relationships later in life, and they create a healthy society. So therefore, breastfeeding is the single most important thing that enables not just a happy mother. Of course, I'm not going into the benefits of breastfeeding with respect to the mother. That's a whole chapter in itself. But with respect to the baby and the mother bonding, there is nothing like breastfeeding.
So, thank you so much, Dr. Bhramara. So, to have a look from the Ayurvedic perspective, there is something called Stanya Dushti we discuss about. So, Dr. Aparna, coming back to you, I think you have some perspectives to share on Stanya Dushti. So, the Ayurvedic concept of Stanya Dushti, how it addresses how the mother's diet and activities can affect the quality and quantity of her milk. And this also suggests that treating the baby's symptoms alone is not alone is insufficient, and that addressing any emaciation in the breast milk is very essential. So, can you please share your views on this?
Thank you, Sharika. Yes. So many mothers come to me telling that I'm not producing enough milk, and the doctor has already prescribed Shatavari, which is a popular, a galactogog, and still I'm not, able to feed my baby. I'm eating the laddus, postpartum laddus. I'm drinking ajwain water, but nothing is helping. So here, which is what is more important, is the inflammation. I'll again come back to the inflammation part, because many of the mothers are not taking care of the conceptual care is not proper, so that inflammation get carried away in the mother, and that gets manifested as some problem in the baby. So the mother cannot produce enough milk, and the breast milk is polluted, or it is it is mm, not getting produced properly. And I would like to share an experience. I got a patient online from Tamil Nadu. She was 28 days postpartum. She was not producing milk. She was producing a little bit, but she was telling it really stinks. When I express my milk, I cannot stand the smell of the milk. And in Ayurveda, it is tell that the breast milk, when it starts smelling like a dead meat, a dead or foul smelling putrefied meat, that means there is a serious problem in the mother's health, right? So what I did was, and she was already taking Shatavari and it was not helping. So I said, stop Shatavari. We have to fix your body. We have to fix the inflammation. And I started with some stanya, and not purifying herbs, like the breast milk purifying herbs. And within a week, she said the smell is gone and I'm producing enough milk without even taking Shatavari. So it is very important that when to use herbs, how much you should be using, and you have to consult an experienced Ayurveda doctor to understand what is the problem. And I would like to also share an experience. I had a patient, an 8-month-old baby with a lot of hives in the body. So the mother is a doctor, so she gave prednisolone, and she was on antihistamines. Nothing was working 2 weeks, and it was giving temporary relief. And again, the next month it came, and the mother did not want to go back to the prednisolone and the antihistamines. So she came to me and asked, and I said, see, if the baby had the problem, then it would have responded, but the problem is with your breast milk. And then I said, then she said, how can it be, right? So I said, even the Western medicine researchers are also now proving that the breast milk contains few chemicals which can influence the health of the baby. So it's a hard conversation. And I said, try this medicine. I'm not going to give anything to the baby. Just for 2 weeks you take this. And within 3 days of mother taking the herbs to purify the breast milk, and the baby started responding. The hives came down, and in fact, I've shared this photos also in the social media to create the awareness. And the mother was very happy. The doctor was like, the concept of Stanya Dushti is so real, and she was like, I could really relate to it. And she was telling, when I was taking the case of the mother, I said, how was your health? And she said, I'm not sick, my baby is sick. So when I saw the diet of the mother, she was eating a lot of prawns and a lot of heat generating food. She was taking a lot of pickles and a lot of sour and fermented food, and she had a lot of body heat issues. And also she was really kind of irritable, and the mind was also agitated. And then we started giving herbs to cool down her body. We started purifying her breast milk, and within a week, it was all gone. The baby, now it is already 3 or 4 months. We just treated the mother for 2 weeks, and that's it. Never the hives came back. So that was, and I treated another lady from Punjab. So she was taking panjiri. So this is a typical laddu from the northern part of India, which is given as a postpartum this thing. And the problem was, she was not hungry. The mother was not hungry, and she was eating, and the mother-in-law had made a lot of panjiri. And I said, your hunger is not good, so I think it is better to skip it for 2 weeks. Then she said, no, this is a tradition which we have to. And she brought a lot of laddus, when she came to see the daughter-in-law and the son. So I said, see, that is all there, but your body cannot digest it at the moment. So you just keep it aside and take these herbs, make your digestion better, and then you can start with the traditional practices. So we have to assess what climate the mother is in, what kind of inner climate the mother is in, whether she is overheated or too much of air filled up, the vata imbalance of air and space imbalance, or the fire imbalance, or a lot of mucus and inflammation. And then only after consulting an Ayurveda doctor, you have to take the postpartum care. So this is also very, very important. I had a patient who was telling me that, I said she was in this was an online consultation. So she was in US, and I said, what all practices are you doing? She said, I'm taking ajwain water, and the moment I take ajwain water, which is carom seed water, which is popularly used postpartum, she said, I immediately feel a lot of body heat and I get body acne. So I said, stop it. Instead, use fennel. So I said, no, I read in Ayurveda, online blog that ajwain water is good for me. So for the postpartum ladies, I said, yes, that is, but your case is different. You are a pitta imbalanced mom, so we need to treat you, not, you cannot follow the tips which you see in the social media platform. So I would like to highlight that you need to work closely with an Ayurveda practitioner who has a good knowledge with this, and then only go into the postpartum care. So this is very, very important. And one more thing I have to have to make sure that we all have to understand this. We need to reinforce the digestive and metabolic state of the mother. Agni Deepana and Pachana is very important, because the mother has gone through the 9 months of the whole messing up of chemical and hormonal changes in her body. So reinforcing the digestive and metabolic state of the body is very important. Replenish the body by imparting strength, that is dhatu paripurnata, dhatu pushti, and help the mother to get nourished from inside. And vata shamana, a lot of vata dosha vitiation we see in mother, like shunya, there is a space which is created soon after the baby is out of the womb. There is a lot of space which is created, and the body needs to go back into that normal state, right? So it also needs a lot of time. And raktavardhaka, in the process of birth, the mother has lost a lot of blood, so increasing the blood is also very important. The herbs and the food which can improve the circulation, increase the blood, is also very important. And ensure good quantity and quality of breast milk, that is stanya vardhaka and stanya uh, shodhaka, that is purifying the breast milk and also improving the quality of breast milk. That's also very important. And then garbhashya shuddhi. So after finishing all this, we need to make sure that the uterus is cleansed, so that she can start having a normal menstrual cycle, which is a very important process for detoxing a lady every month. So this is also very important. So it is not just you get pregnant, you give birth, and you start with your daily routine. So you need to um, uh, take care, and this is a very very holistic, very prayerful process, I would say, and a holistic care is needed. We need to onboard a gynecologist, an Ayurveda doctor, and a yoga practitioner who has good knowledge to integrate and uh, give the best to the mother. And I hope more platforms will come up to encourage this kind of formation. Thank you, Sharika.
Thank you. Thank you. I think the laddus can be eaten by all the family members to contribute to the mother care instead. And I also want to share that Dr. Aparna is one of the most sought out social media influencer on Instagram. She is very popular with her fiery comments and posts. It really influenced a lot of people. Thank you so much for that. So, and we are getting a lot of comments. One of them I would like to read out. We are very happy to know that how Ayurveda has changed the whole concept of baby and mother care. Our ancient knowledge and modern way of life merged into well-being. Very good initiative. So thank you for all the listeners who are there. So coming back to Dr. Madhu, I have one more question for you. What do our traditions, including Ayurveda, say about the changes that children go through as they grow? What are the practices which Ayurveda incorporates to nourish and refine children, helping them to grow and be happy and content, not just physically, but also in their mind, emotion, preferences, their perspectives, intelligence. So it seems that at different occasions and different stages of the child's life, there is a celebration, right from Pumsavana, which also has a hidden agenda for the well-being of the child. So I'm sure people will be curious to know what role samskaras play in all of this. So share on that.
So I think as a Kaumarapritya practitioner, usually, or a teacher, I would say when the topic of samskaras come, it's like a fun topic. Everyone looks forward to it because it's like you're talking about kids and the amazing things which they learn. They're such sponges which like capture so much knowledge from around them, and they're just like growing and changing every second. But I think I will start with the samskaras, which, since we were talking about pregnancy first before the child, let me talk about what the relevance of samskaras are in the mother before I go to the child, because both are as important. So, samskaras are translated as basically rites of passage, or where there's a major change which is happening in your life, and that is marked by a religious festival or just a mark to say, oh, you're capable of something more. So there are Shodasha samskaras, or 16 basic samskaras which are explained, but through the other textbooks, classical texts which we see, you can almost go to 108. I'm obviously not going to explain all those 108, but just to give the relevance of what they mean. When we talk about, just to give you an example, during the pregnancy time, right, there is a Simanto Nayana which is done. It is a specific samskara which is done around the final trimester. Nowadays, people celebrate it as a baby shower, and they're like, oh, the mother needs to be like celebrated and she needs to enjoy herself because basically her freedom is ending and her whole life is changing. So that's the way in which it is viewed. And I must say, in my lack of knowledge about the importance of this samskara, I also questioned it, because it is a traditional practice where they literally like take a pot full of cold water and pour it over your head. And I was giving birth. This fell during the winter period in Bangalore, and I said, I will fall sick, so I'm not going to do this. So then I went into the classical text and I said, why is the importance of this samskara at all? Where they talk about a pig's nail, where you have to make a parting in the hair. That didn't make much sense to me. So when I was understanding the relevance of the samskara, I found that the mantra chikitsa, which they are doing, has so much value, in the sense that we're talking about integration, we're talking about perspectives, we're talking about how to make this holistic life achieve health or promote health in an individual, right? So in that Simanto Nayana, it is such an important process where there is an Agni which is created, and they chant mantras and they do puja to this pot of water. And there is a beautiful study which was done in Japan, as a matter of fact, which shows that water has the capability of capturing the vibes or the energy of both positive as well as negative things. So when you are doing this mantra chikitsa and basically saying, oh, let this woman have a positive, good, happy labor, let her not suffer through this once, through the various mantras which they chant during that time. And that potentiated water is basically like poured over the woman's head at the end of it, right? And the concept is, when you are pouring it on the head, and again, I wish I had known this before, I did not do it, and I wish I had. But the point is, when you are doing that, you're actually stimulating the endocrine glands, in the sense that the hypothalamus, pituitary, ovarian axis, which we know is so important to this, we are stimulating that by doing that cold water. That it kind of stimulates that, and it has a positive influence on the rest of the labor. So like that, when we see each and every samskara, even though we do it as a fun party, like everyone comes, it's a chance for everyone to meet each other and enjoy good food, good company, I guess. It also has a relevance on the growth of the mother, the growth of the child, and so on. So if we see even at birth, it is a very beautiful samskara which is explained, which says, as soon as the baby is born, you need to initiate breastfeeding. We were just talking about breastfeeding right now to say how important it is and how difficult it has become. It was such again, a shock to me when I went to, the hospital, and they said, mentally prepare yourself for breastfeeding. I said, what do you mean by that? Naturally, that's the next step, right? Once you have a baby. And then they said, no, there are so many mothers who are not ready to breastfeed, because it's like they have to be locked up in their room and their baby is the only thing. They feel like cows that are only feeding their children and all of that, and they have nothing better to do. So I was like, seriously, I didn't even know this thought process existed. But now working with couples, I see that it's very natural. They're like, really, 6 months? I was like, 6 months passed like a flash. And then you're like, I have to give this up. Why? I don't want to give up breastfeeding. I wish I could continue it for longer if possible. Right? So that bonding which we were talking about is so amazing. So they say initiating it as soon as the baby is born is so important, because that letdown reflex, that stimulation of the oxytocin, prolactin, which we were talking about, can start at that moment. And that is very, very important. Then the next thing which they say is to keep a pot of water. So this pot of water also seems so weird. Why do you keep a pot of water? If you go deeper into it, the concept is that the baby is coming from water. It is in a amniotic sac filled with fluid, and it's coming out to a relatively drier area, wherever it is, even if you're in a humid place like Chennai, where I come from. But the point is, it is not the same as being inside water. So that pot of water makes all the difference. Like nowadays, they're talking about humidifiers, which prevent, the nasal issues which can happen in a child because they're not able to adapt the environment. So just that pot of water of hot in a cold season and cold water in a hot season can change the way in which the baby arrives into this world, right? And the third aspect which they talk about is, of course, the combination of honey and ghee, which they lick to the child. And the concept there also is a kind of a vaccination, or what they call as a Swarna Prashanam, etc. The concept being, when you give honey and ghee in equal quantities, it is a visha. So you're like, why are you giving visha to a child? But the concept is, if the child is able to handle the visha, then any form of infection that comes post that. And now, as a pediatrician, also working with Ayurveda on the side, I must say honey is not probably the greatest idea right at birth. Till 1 year, we do not suggest it. But the point is that this was there in the classical text, and the relevance of that was because it is one of the most immunity building substances, and therefore they considered that with with ghee in a small quantity at birth may not be an issue. But of course, we have to rethink that in the present scenario. Similarly, as we move on, there are samskaras at each stage. So you have what are called developmental milestones, which indicate the growth of a child through gross motor, fine motor, language, social development, and so on, right? And this has all been taken care of through certain samskaras which have been explained. So I just like to maybe take 2 or 3 examples. I think we are running short of time. So the first yeah. So the first one, which I'd probably like to talk about, is where they talk about in the 4th month, where you take the child for nishkramana. So they say you take the child out of the house. Now, nobody does that. 15 days, either they're taking them back from the hospital, or 3rd day they're moving, or someone has delivered in their hometown and they're traveling back to this one. So within like the 1st month, the child usually either goes by train, car, or flight somewhere. But the point is, the concept of that time was, as Dr. Sharon was talking about it, in the postpartum period, the mother as well as the child are very, very prone to getting affected by infections, because the immunity as such is on the lower side. So that's why they were protected by saying, stay inside for at least 6 weeks, stay inside at least for 3 months, 6 months, till you are back to some form of normalcy, and then you can travel. So that's why they said in the 4th month should ideally be the first time that you take the baby out. Again, to rethink it in the present day. But this could probably be like for a social gathering, right? Where you go outside to a temple, and there you can see that the child is picking up its head and looking around of social interaction. And obviously when someone sees a baby, everyone's going to be like, oh, you're so cute, or, they'll just make some funny face, and immediately the child smiles. They want to elicit that, the social smile. So here we're talking about 2 very important milestones of a gross motor as well as a social interaction interaction which comes into play, right? So that's where we have one Nishkramana Samskara, which is of course given a lot of importance. Then you have the Upaveshana, which comes towards the 6th month, where they say you try to initiate the child to sit. How? By doing it as a festival. You keep all of these lovely, decorative, attractive, even the toys are given so much importance. They've explained in the classical text how they should be. They should be full of sound. They should not have sharp edges. It should be attractive. The child should have varieties of things which they recognize. It should be like a cow or a cat or a horse or something which the child recognizes, so that they feel excited when they look at it and they go and grab it, right? So by that, you are making them get into that posture of sitting, and you're also making them realize that, okay, this is the fine motor skills of grabbing something, picking it up and bringing it towards yourself and throwing it. So those are also developed through that samskar. Then we move on to, of course, Annaprashana and Falaprashana, which kind of come together now. Nowadays, when Annaprashana, it's like a full, I don't know, festival for the, I think, the community rather than the child. There are different traditional practices which are there, where they make a feast and then they give like a drop of each thing to the child, which I think is quite a bit for a child who's never eaten anything. But anyway, that's a traditional practice which is done. But the concept is that in that Annaprashana, you have a beautiful shloka which is recited before you give the first mouth of food to that child, to say that this food is similar to Amrita, similar to how for the elephants Sudha is, and how for other people this one. So for the human being, the food is considered to be Amrita, and let that nourish and make you healthy, right? So saying that we start this food and initiate the process of digestion in the child. And Falaprashana also, it's my personal favorite topic again, because I think Kashyapa Samhita is the only one that explains about it. And it says in the 6th month, very specific fruits have to be given. They talk about raisins, they talk about dadima or pomegranate, they talk about like matulunga or a type of lemon. And the concept, if you see, as we go into the 6th month, the breast milk is incapable of supporting the quantity of iron, vitamin C, etc. So mostly they will suggest, why don't you start giving supplements to the child? And look at it. They talk about dadima, and dadima is something which is very high in iron levels. And then you have something like matulunga, which is a type of lemon, which we know contains vitamin C. And very commonly, as you start introducing foods, the child starts developing constipation, for which raisins are a great choice. The child starts developing like excessive gas, diarrhea at times, for which the pomegranate is also a great choice. So it's just so beautifully curated that to make sure that at each starting point where you are introducing the child to something new, you're making sure that you're taking care of the complications also, right? So like that, we move on where they talk about like Akshara Lekhana, where, the child, when they show interest in studying, like 5 years. Nowadays, school is like till 6 years, you should not enter into the first standard, etc. In Karnataka government and other places also, it's like that. Because till then, the child is not ready to hold something and write, etc. So the Akshara Lekhana was done at 5 years, because they show that interest and they give them like a plate of rice and they like write your, the first letter to initiate you into that. So like that, the way they've taken these samskaras to also like if you see the Godana Samskara, which is done during puberty, is also a very important one, because there they are telling the girl or the boy, hey, you're entering into puberty. There are changes, the secondary sexual characters which are developing in you. In a woman, it's different. In a male, it's different. So get prepared for the changes which you're going to get into, and be prepared that the future, you're no longer a child, you're entering into a different stage of life, right? So that way, each samskara marks a specific point in life, and when we go into the relevance of that, it is pretty beautiful.
Thank you for going into all the details. I think this is something all should know, especially nowadays. People, there are some group of people who are interested in it, some who are totally unaware of it. Anyway, thank you so much on sharing all that. So coming to samskaras, but then there is something else, Garbha Samskara, which is also quite popular now. And I would like to ask Dr. Divya, who is also our in-house doctor at Shri Wellbeing, can you share in a short time, like how you are helping couples in their journey from preconception and even women during the pregnancy? Why do you think it is necessary at this time?
So I think about the preconception, conception time, Masanumasika, and post-delivery, most of the doctors have shared very beautifully. So I'll just say that, during my period of, conducting various programs based on Garbha Samskara, what I found is women today needs assurance. Assurance is the confidence that they can handle everything, and that's what is lacking today. There are a lot of information which are available online, and on the YouTube, for the yoga, for the music, or maybe with the diet also. But if you are aware from the roots, like, learning from the roots is very important, and such programs do that, a proper guided programs, and again taking further follow-ups with the doctor, Ayurvedic physician and yoga practitioner, yoga practice, that will help you to add on that. So I'll say it is going to boost your confidence. Then again, create an atmosphere to be at ease. Once we have an umbrella and it's raining out there, what we feel? We feel so, a strength within, no, I'm very confident, even if there is a rain, I can walk through, it's going to be easy for me. I can manage things. So here, such programs also highlight the benefits that, the correct information given in a correct way will help you to take care of entire journey. It will make your journey more beautiful, because preconception, as Dr. Aparna was sharing, that there are a lot of inflammation which occurs during the preconception and even postpartum care. So the knowledge about both the phases are very important. Apart from the pregnancy care, the diet during the pregnancy is one part, but what women are lacking today, what the families are lacking today, is the support which the women need during the preconception, and also postpartum, because it's not a very simple or easy thing, because women needs 5 weeks or 6 weeks or maybe year to come back to her pre-pregnant state, though the uterus may be in the pre-pregnant state, but the characters, the feeling, the level of the hormonal changes, a woman needs some time and she needs assurance. So that's what I feel that this programs like preconception to post delivery helps us. And Garbha Samskar is very necessary, because detailed explanation of each samskaras is also done, as Dr. Madhumitha was explaining. So with a scientific backup, you feel more confident, to perform each of them.
Very nice. Very nice. So before we move to our last question, I would like to play a small snippet from our dear Bhanuma, Gurudev's sister. So she has played a pivotal role in causes like providing free education, building schools across India, and also being bringing women leaders together. So she usually, she will infuse you with her conviction that meditation works. And let us watch this video where she speaks on motherhood and meditation. And also, I want to share that with the audience that all the doctors gathered here are meditators. So let us watch the snippet, small snippet from Bhanuma.
Basically, girl, everywhere she becomes a mother. Motherhood is also born with motherhood, both involved. That's a new experience for her. Along with the new baby, she is also feeling everything new, inside, outside. Inside also, so many things has really changed for her. So that is where there is an uncertainty. That is when you can meditate and we gain the strength within. However much you keep talking to people, you give them all these advices, doesn't go anyway, the insight. It goes from here. Because there is something else that's going on. Physical and mental and emotional layers. So that psychological and physiological changes only one understand. So maybe counseling 5% to like that. meditation properly done, 100% result. Mood swing has many tests. So that is where the Ayurveda can have that holistic approach, when we can give through meditation and medication, we can manage this. Like management only is necessary. So Ayurveda has a lot of solutions. So also meditation, spirituality. Ayurveda and spirituality have same source. That is where there is no conflicting interest, easy connect, harmony. And I really like Ayurveda techniques and Ayurveda meditation. You know why? They don't hurry you. Like they don't say, oh, immediately now, if I have a headache, immediately it will go. No. Ayurveda doctor, they'll give you so much, and then after 1 week, they'll say, 1 week, it'll be fine. Take it easy. Like it's not an instant cure, but it's a permanent cure. Like that, even meditation offers you long-term benefit. It's a long-term solution. So it's not like a quick fix.
So that was very, she was mentioning about how it will not hurry you. So anyway, Dr. Spandan, now the last question to you. You are a mother and you are also a meditator. Even before becoming a mother, can you please share how it helped you? How being a meditating mother has been helping you? As Bhanudidi said, a happy mother makes a happy child. And coming back to our opening statement, what makes a child grow up to be a happy child?
I think it all begins and ends with the mother. I conceived when I was 36, and it was in peak COVID. So it was a very scary experience. Thank God for meditation. I was able to ground myself because both of us were going to be parents for the first time. And there was such a barrage of advice that was coming from everywhere, requested, not requested, what to eat, what not to eat. And meditation really helped me to build my intuition. So I was able to intuitively know I should be doing this, I should not be doing this. This is such an esteemed panel, everybody were, giving their advices, and I didn't have access to any of you when I was pregnant. Can you hear me?
Yes.
Sorry.
Now you're back.
Okay.
Yeah.
So not only was the whole journey of pregnancy easy and very reassuring, it also helped me to enjoy the journey of, connecting with my baby, connecting with my husband. I think the connection gets reborn when you're pregnant, and connecting with my child, because, the mother is only half the story. The baby has already chosen how to come, when to come, where to come. And it may not always align with the mother's expectations of how she wants the birth to be, in spite of doing whatever she has done, yoga, lamas, meditation, all of that. So my ability to be in the present moment and my ability to connect with the child and give importance to what was needed at that moment. I'm a C-section mother too. And I was able to make that choice. That conscious strength came because of meditation. So my journey into childbirth was because of confidence. And Bharuma herself had said, meditate. And I was very lucky that ways. So, and I see that in my child. My child understands that it's not two immature people dealing with her and unloading our stresses on her. So when we deal with ours, then she has a happy childhood. Sometimes children have to grow up very quickly because they become the managers for the parents, become the negotiator, ceasefire for children. Need to enjoy childhood. And I think it's just made us very sensible parents. It's made me a very sensible mother. There are a lot of things that I deal with on a daily basis, and I can see her blossoming into an adult. In fact, my mother has made this statement. She said it, I wish I had meditated when I had you, because she had history of loss of a baby, and 1980s, it was a different ball game altogether. So she said, I see you being so grounded. I'm being available, emotionally available, spiritually available. And I think that's what children look for, safety. And when adults don't feel safe, what are they going to offer to a child? So meditation it's our anchor. It's my anchor. And the days I don't meditate, now my daughter, she's going to turn 4. She says, Amma, go do Om. Go to your Kriya. You're going to scold me. Go meditate and come. So we see that when we look at a child, we look at the whole family as a dynamic. And in that dynamic stays in balance because of meditation. That's a responsibility we need to take. So I'm very grateful that I learned how to meditate before I just makes life more easy to live.
Wonderful, wonderful. So a happy mom, happy child. It was wonderful listening to you all. I think we started off with a 60-minute plan, but it just flew by without anybody noticing it. Thank you all for joining us today, and we are so grateful. Shri Wellbeing is so grateful to all of you and sharing all those beautiful perspectives. I'm sure many people will gain so much awareness, so much of things to look forward to. And I'm sure this is not going to be the last such session, many more to come. I wish this Happy Mom, Happy Child continues to be like a series, so much to discuss. So thank you all once again. Thank you so much. Thank you.